Thank you, Mr. Chairman. And last year in Tennessee, we had over 3,800 overdose deaths. And these were primarily fentanyl. It was involved in 75% of those cases. Now, one of the things that I hear from our healthcare professionals and our law enforcement is they can't get their arms around this until the southern border is secured. And they talk about the uptick in using Narcan. They talk about the need to address these smugglers. I've got the Stop Fentanyl Border Crossings Act, which would add drug smuggling as a basis for Title 42 immigration enforcement. I know my colleagues have said there's a vote on the floor later this afternoon to address the border. It's an immigration bill. It is not a border security bill. And what people want to see is for all of this trafficking to stop and to stop pushing these drugs into our communities. And I appreciate you all being here. And as you've heard, we've done a lot of bipartisan work on medically assisted treatment. Senator Hassan and I have worked on some provisions. Senator Thune and I are working on allowing states to waive the IMD exclusion for substance use disorder treatment. And I fully feel like that any treatment that we have has to include prevention as well as the treatment, and then also enforcement, and making certain that people have access to that continuum of care. Recovery is not, as you have said in your testimony, this is a long road. And not everyone is willing to talk about that. But we have the Telehealth Response for E-Prescribing Addiction Therapy Services Act, the TREATS Act. And Senator Whitehouse and I and others on this committee have worked on this because it would address some of those barriers that a lot of individuals face as they are trying to get the care they need. And it would give that critical support. Dr. Herron, you just talked about this, in underserved and rural areas, and getting that help to people. It would leverage telehealth services. So I want to come to you, Dr. Herron, when we talk about the TREATS Act and how it would enhance that accessibility and efficacy of these services and e-prescribing. Talk a little bit about how it would fill in those gaps in service and why we need to do this.
Thank you for your question, Senator. Telehealth has been one of the greatest innovations to ever come to behavioral health, and it's one of the good things that came out of the terrible tragedy of the COVID pandemic. We have seen incredible improvements in access, in engagement, in quality of care through telehealth. As I mentioned earlier, geographic restrictions.
Yeah. What about compliance?
People are much more likely to engage and remain in treatment when they have multiple options to access care.
Okay.
So hybrid treatment options are really wonderful, where you do have the ability to still see a treatment provider in person and are able to do certain things that benefit from those face-to-face interactions, and the combination of doing that with the ability to access remote care. People no longer have to arrange for child's care, take off time of work, figure out transportation, how to get there. What could be a 30-minute, really the whole time face-to-face with a therapist was a 2-hour, 3-hour event to be able to leave, travel, wait in the waiting room, do all of those things. So people are able to still get the same quality of care in a much more efficient way. One of the things that's essential about the TREATS legislation is the addition of the provision about audio-only telehealth. Yeah. I do want to stress, and it's hard for us all sitting here on our smartphones to remember, many, many Americans do not have access to high-speed internet, to devices with cameras, to phones with data plans that they can use to access video. And so the addition of audio-only services as part of the treatment landscape is really essential to maintaining access for people.
Thank you. I'm almost out of time. Dr. Perrone, I will send a question to you. I want to talk about prescription opioids and those that are dealing with pain. And as we look at the overuse in the prescription area, how that affects the use of heroin and fentanyl. But I'll do that in writing. Thank you, Mr. Chairman.
Time,